Hey, this is Irvin coming to you from Resilience Occupational Therapy. In this episode, I'm going to talk a little bit about an exercise for your low back and hips. In some of the other ones we talked about, the multiple planes of motion that you have in your SI joint, in your hips, and in your back. And every time you take a step, you're actually moving your SI joint, ideally. So this exercise is simply having one foot in front of the other, about hip widths apart, and shifting your weight forward and shifting your weight back. So putting your weight onto your front leg and onto your back leg. It's a very small movement as far as what it's doing for your low back. But if you have a lot of pain, this is a really good one to start to shift your SI joint a little bit without it feeling scary. Now, as you do that, you can rotate a little bit towards the inside of the front leg and then towards the outside of the back leg. So inside, outside. And if you switch feet after a little while, do that 5 or 10 times. But if anything ever hurts, then you can stop right away or just slow it down. So again, you're going forward and back, shifting your weight onto your front foot, onto your back foot. And on the front foot, you can shift your weight in if you'd like, so that you're going in from the front foot. And then in the back foot, you can go shift your weight back. So you're shifting your weight back and forth. If you want to make this a more full body activity, there's an exercise that I've done in Aikido classes before where you're pretending you're rowing a boat while you're doing it. So you've got the oars and you're extending your energy out and back. And you can exhale on each one if you want. So that's a good exercise in and of itself for the upper body and for having a sense of stability and containment, as well as mobility and being able to take a little bit of those micro shifts for your back. So of the back exercises that I've shown for mobilizing your low back, this one is the more subtle of them and is really meant, it can be done for anyone, but if you have more acute low back pain, this might be one that feels safer than some of the other ones.